Alright. Cool. And that should go. What I need here. Do I have all my equipment? I do have everything. What the hell was I doing before? Kyrie Legion, down, doesn't do anything. Inventory, turns, and then, okay, so I guess I just manually buffed myself. Okay. Do I have any fly wings? Why don't I have them set? Oh, because I have this as level 1. That could work. Let's put the fly wings back here. And then I don't need any of that. And then this needs to go. Okay. Perfect. Perfect position. And so let's see. Turn undead. Gloria. Ah, shoot. I need to get used to using fly wings the right way again. And then let's bring that down a little bit. Left is heal, up is CE, turn undead. Okay. And oh, get that set over here. Let's see if I can be on these. Cool. That connected. And cool. Oh, nice teleport. Okay, let's refresh. And good stuff. That's a lot. I'll have to get lucky on this one. Oops. There's one. Ooh, I am losing it. Dang it. Okay. Come on. There we go. Is that a mimic? Yeah, it's a mimic. And nope, not this way. Oh, there's one. Don't give me too bad. Good stuff. Alright, let's chill here. What do I have as sit? Don't I have anything as sit? Uh-oh. Gotta try to do it. Nice. Okay, what the hell did I have keyed off to sit? It's not up, it's not trigger. Oh, there it goes. Left click. And right click is, right is, skill tree. Okay. Turn undead's fine, everything else is good here. What just buzzed me? Oh, Twitch stuff. Alright. Good, we got full click. Let's see here. Kyrie, Gloria. Oh, there's next victim. Wabba. Hey, hey, hey. Don't be hitting me like that. Ah, I only do... He's gonna hit me super hard now. Uh-oh. Uh-oh. My heels suck. I need to get this curse off. Okay, good. Curse is off. And then, how did I end up doing this? Oh, that's right, I pinched in and pitched out. There we go. Now I'm not as far away. Second job, third job. I have 3 skill points that I need to set out, but I don't have anything in mind. I can't use this on myself, right? Can be used on others and will not work on caster. Yep. I don't need resurrection. Gloria's at max. Yeah, I really don't have any need for it yet. Alright. Let's go and repop that one on. And Gloria. How much till I level? Oh, I'm about to max job level. Okay, cool. There's one. You little punk. Ow. Ow. Dead. Dang. Really lucky on that one. Alright. Heal. Who did I just bless? Oh, what was the plan? I was trying to do a lot of steel. Let me get some fly wings. Additional fly wings. I don't have any. Do I have to buy some? I do have to buy some. Oh no. I do. Okay. Is there anything I can drop off that I picked up? I can throw these into there. Yeah, nothing really in this area. And then actually, what do I have? In the bank. There we go. About 90k. I'm pretty sure my other character has the rest of it. And someone was selling Ellie weapons here. Claymores, Damascuses. Where is that merchant at? It's right here. Cool. Oh no, not innkeeper. Dope. Fly wings. I'll need 30 extra ones of those. Bye. And then let's warp to Enbrock Field. And then, how did I do this? I think I go up in here, and I'm in the city, and I can't teleport, so I have to walk this. Yeah, I can't teleport. Okay. A dental doctor. Oh, sorry if I missed your message early. Hello. I am a dental assistant, registered dental assistant, and I've been doing it for about 15 years or so. So if you have any questions, I probably have an answer. I also teach dental assisting and everything like that, so if anything ails you, you can kind of ask my opinion about it, or we could try to get something figured out. But yeah, I just like playing games, and I found a place to do it and help out anyone that might not have the opportunity to talk to a dental person. So that's my weird angle, is to be terrible at games and answer dental questions. Dang it, I didn't want to fight one of those so super early. Okay. Oh, these guys are loud. I need to turn this down. Pull this down a little bit. It's not as loud. Cool. Is it better flossing or using blistering mouthwash? Good question. Let's jump into it. The main thing when it comes to if you only had the opportunity to do one, brushing, flossing, or like you mentioned, mouthwash as an option, you're better off doing flossing overall every single time. You can kind of look at a Listerine mouthwash as it's killing the bugs it's killing the germs that cause cavities wherever it can reach, and it can reach on top of the tooth, on the cheek side and the tongue side of the tooth, but it can't reach on the in between. So no matter what, your toothbrush can't reach in between the teeth where they butt up against each other, and the mouthwash won't be able to get in that area either. So you kind of have to make a choice on which one you're going to aim for mainly. And so, big recommendation: floss constantly, or be diligent with flossing as much as you can. Um, and if it's like, oh well, I don't know how to use like the string floss, get those little floss picks, the ones that look like a little C. Oh, I died. That sucks. Get the ones that look like a little C and just use those as best as possible. It's the best thing to do is floss over everything. There's another alternative. There's another alternative out there, which is called a water pick. It's kind of like a little machine that shoots water in between your teeth or into your gums and everything. That's a good additional thing, but floss, just a piece of string going in between your teeth and clicking up, clicking down, that's the best situation overall. Another, you can kind of think of cleaning your teeth as kind of like a grade, and you always want to be at like 100%. Every surface of it is clean. Well, a tooth has 5 surfaces: the cheek side, the tongue side, two in betweens on the front and the back, and then the top, which is going to be your chewing area. And we can clean 3 of the 5 sides. And if we translated that into like percentages, that would be you getting 60% of your tooth clean. And 60% of like 100 in grade wise is still a D or failing. So to get those extra 2 surfaces in between the teeth, flossing is going to get you that perfect A grade of your whole thing is clean. But that is one of the most common questions. Don't worry, that we usually get that people ask on this channel. It's a very important one. Yeah, because sometimes I still recommend it because teeth are going crooked, but I'll try to investigate into that C-line floss. Yeah, especially when it comes to it, and it's a specific way that you should floss. And I actually have some right over here, so one second. Okay, cool. I got a big old spool of it. Of course, I probably should, and I can use it for like a lot of things. But when you get your piece of floss and everything, the main thing when you're going in between and going on those teeth is to make a C-shaped type of motion. And so, as an example, do I have a pair of wire clippers here? I should have some. I guess I don't. But when you're going up against something, I guess I'll use my head as a tooth and everything. Going against it is fine. Lots of people usually just go through the tooth and then come back up. What you want to do is go into the tooth, or go in between the teeth, click down, and you're going to want to ride against that tooth and go up and down, up and down. It's kind of like making like a squeaky clean motion where, like when we dry ourselves with our towels, that towel is wrapping around our body. Same thing with the floss. Wrap against the tooth that you're interested in, and then wrap against that other tooth that is right next to it. And you do that enough, you do that well enough, you'll reduce cavities in between the teeth, and you'll also improve in like the freshness of breath. And so like you mentioned with the mouthwash and everything like that. What I like to do personally is I put a little bit of mouthwash into my mouth, and I'll floss the mouthwash kind of into between my teeth, and it feels extra clean at that point. But yeah, like some doctors said, crooked teeth are hard to clean in between, but there can be a way, and sometimes the string floss is good at that because they're at like weird angles. They're kind of crooked or behind each other like shark teeth. So these work decently, but if you can't get into those little picks, they work great. They have different colors. Go to the kids section. They have flavored ones like grape, strawberry, watermelon. I use that on my kids all the time. I love it. Use it on my kids. Use it on myself. Because I've only been doing the string up and down all the time every morning, and you're really not to blame. Whoever told anyone how to floss properly. The people that should be responsible for it is us, dental assistants, and your hygienist that does your teeth cleaning. And a lot of times they'll just say, "Hey, are you flossing?" And at most they should say, "Okay, show me." They should have you showing us how you floss. And a lot of times it's just click, 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 click. It doesn't have that C-shaped rub against the tooth to get them super clean. So. I have a bunch of cavities, or I had a bunch of cavities when I was little. I felt like, for one, it was just my fault in general, and I never got a really good I never got a real good education on how to brush and floss properly. So, that's what these streams are for. Hopefully, hopefully someone can find a benefit from them and learn a little bit. Yeah, no wonder why I don't. Yeah, and there's always like a conspiracy about that. It's like, oh, well, they don't want you to floss properly because then that will be a cavity later on, and that's something for the dentist to fill, which is a bad way of looking at it. But I mean, it seems that way, so it's odd. It's odd. But you pass on that information to everyone you know. C-shaped floss, like you're trying to dry your back, and you want to rub up against those teeth. It's an odd conversation starter, but it's a good way to get it. It's a good way to keep everyone nice and healthy. Let's see. I want to go back over there to Einbrock. Let's see. And yeah, and that too. Also, some doctors just, it seems like they act like they don't have time to like tell people about this, to teach them. But that's only if they're trying to work really fast. If they're trying to go patient to patient to patient and maximize how much money or how many people they're able to see in a day, then it really doesn't help out the patient a lot, because then they're at risk of all these things, that all this information that they're missing. My thing keeps on flashing. That's weird. Thanks for responding to my questions, Dylan. This isn't odd conversation starter, but yeah, absolutely. If you ever have anything that comes up in your mind, or tooth questions or anything like that, I'm the place to come to off hours, outside of dental hours. So you can always make your way back if you have any questions. Always happy to help. No, my TV turned off. Ah, dang it. It found me. Teleport. Noxious. Another one. Alright, good. This should be a fine place. Imposito Madness. And which toothpaste is better? I see a lot of Colgate Crest. That's also another good question when it comes to a lot of this. The best toothpaste to use is the one that you're willing to go back to consistently. So if it's like, man, I keep using this toothpaste, and every time I buy it, I never want to brush with it because it tastes bad. Get one that does taste good. Get one that you do like. Personally, I like Arm & Hammer toothpaste. It's a very weird taste that like no one else likes, but I do, and that's kind of my go-to one. The main thing you want to watch out for is not specifically whitening toothpaste, but kind of like toothpaste that says, oh, like it's the best at whitening. So that means like it's really gritty. There's a lot of like rubbing. It feels like sand in there, because that's what usually whitens people's teeth, because those whitening toothpaste are wearing out a layer of tooth every single time. It's very small, but it's okay. But one that I use mint flavor, but I try to get Colgate Luminous White. And sometimes these toothpaste that there are options out there can be okay, where they are chemically they're chemically whitening your teeth because they're using hydrogen peroxide or carbamide peroxide, whichever peroxide is out there and everything. So it's not too bad. One that I do recommend to not go towards is a material called. Oh, we got an actual dental question over on YouTube chat. I'll be with you just in a moment too. Main thing is don't use. I highly recommend not using. What is it called? Activated charcoal toothpaste. That that type of toothpaste, you really touts its name out there because it's very gritty. It wears away at slivers of tooth structure. So if you do use it, I recommend just once a week if you're going to. But apart from that, I'd say stay away from whitening toothpaste if you can, and just use everything else. But like I mentioned before, I like Arm & Hammer. It's just because of the taste and everything. And then over on YouTube, how can I prevent cone cut x-rays and overlapping any videos you have? I'm going to call you Danny. Perfect. Danny, yes, I do. I do have dental videos specifically about that. And if I can just bring this up here real quick, 1 second. I have on my channel, and especially as you're over there on the YouTube side and everything like that, my channel has a lot of those. Hold on. For one, how did you find me? It's very odd, especially having dental knowledge. How did you come across me or my channel? That's something to kind of address. So, on my videos and everything, apart from me being live, some of the videos that I have here, one of them is going to be, what did I do recently? Oh, go for it. Oh, thanks. Oh, I've seen Colgate Charcoal before, but I didn't know if it was bad. It's not that it's bad. It's just it's a little bit aggressive. I have Danny over here. I'm a new dental assistant. I subscribed before I came to DA. Oh, cool. I love it. Oh, that's awesome. I do have specifically 2 videos about x-rays. So one of them is going to be about doing XCP x-rays and everything like that. And so I have a couple right here. We have, dang it, this is my gosh darn little thing that I'm having an issue with. Okay, good. I have a FMX for XCP, so that's like the ring system, the RIN system, whatever your school calls it and whatever. And then I have a bite wing video. So you might be kind of referencing also more of a snap array, because usually with like cone cuts and everything, those are usually based on like either snap array or bisecting technique, whatever you guys are calling it, because you don't have that ring as a guide or everything like that. Which I do have videos on there also. It's just kind of one of my older ones for like films, but I do have a ton. One of them should be here. Yes. Oh, this is going to, I'm going to lose my mind doing it. Next time I need to just do this on my computer side. But yes, I do have some X-ray videos, bite wing videos, mixing material videos, pouring up impressions, taking impressions, model trimming, all that stuff. All that fun stuff that we potentially have. No, it's just card where I came a day. That is good though. Another question, cool, from Wolf over on Twitch and everything like that. Let me go and bring this down for a second, and bring this back up. Am I dead? Why is that not coming up? There it is. Cool. Another question. The front of my teeth are not lined up properly. Like I bite and my teeth are not lined up in the middle. Oh, okay. It's good that you mention lining up in the middle and such. And actually, let me take a break from this. And I'm going to switch from here to Classroom. Oh, my input's working? Oh, good. My input is working. Not this one, not this one. This might work. This may work. Let me go and shrink myself down a little bit. Cool. So you mentioned misalignment on your teeth. So, well, when we have teeth and everything like that, let me try and bring up paint, and then let me get a image of a smile. Not the movie Smile. Teeth, like there anything would be smiling. Typodont teeth. We'll use a typodont set of teeth. Cool. That should be a good image that I can work with. Keep the canvas size, and let me see. And then Danny, if I didn't really answer your question, I definitely will get into it if my video doesn't cover also. Let's do paint. Alright, so I have my piece here. And with this piece that I have, the main thing that we should be seeing here is definitely a lineup between that top tooth and bottom teeth. So if you have something where it's off center, where let's say if I go and take this half of the teeth, X, V, or X, new layer, V, and I go and shift it over a smidge, like to the right. It could look off, especially as we are seeing it like that. Let me go and pull this off to the upper portion, and this can be over here. Good. So, what this is considered is called midline shift, where the middle of your teeth line and everything like that, which I can go and throw a brush stroke on, should be matching, and this needs to be a wider brush size, and then select brush size, and then I need to draw on this layer. This is too big. Alright, so our midline should be lining up just right down there, but this midline in this case should be lining up right here from the bottom center of the teeth and going up in this. This side is good, this side is bad. And a funny example of midline shift, as far as us kind of dealing with that, is actually a famous actor, where back in the day he had a humongous midline shift, and that's going to be this fella right here. And let me see if I can get a good picture of him as he smiles. It's very off center. It's actually like disturbingly off center. And that's where we have this fella. And this fella's teeth isn't right. And off the bat, you wouldn't notice it immediately. But if we go and zoom in, because we learned about that midline center, that center line through the center of our face, with him, his midline doesn't match up, and so you have his midline shifted to the left, where his tooth and where his teeth has gone. Brush size, nope, not that one. His midline has shifted in this direction, because it should be right in the dead center of his nose. Now, how can we get this fixed? A lot of times, it's going to be very, a lot of times it's difficult. Sometimes midlines being shifted can happen because your jaw is just kind of incorrectly centered on your face. But a lot of times it tends to be when people get crowns or veneers to kind of fix their teeth up and everything, and there's so big gaps in between between those teeth that they have to fill it up with material. And if you filled it up too much on one side and not on the other, then you get a shift in there. It's not irregular. No one that's dental, nobody but a dental professional would probably know, but you would always know, right? Everyone's their own worst critic, so you'll always be like, man, I hate that it's off to this direction. You're the only person that sees it, apart from dental people. So it's not too bad. I would say you can't like really shift. You can't really like fix it with braces in an easy way, because the way that you would fix that is probably as one treatment is you would wear a palatal expander, and so you would expand your teeth because all of them are touching all of them are touching very tightly at that moment. Use something where you put it on your hard palate and you turn it with a key, and it's going to expand and make spaces in between those teeth. And now that you got your teeth spaced out, now we're going to go and instead of them coming back together and it being off a little bit, we're going to go and pull these together and then pull these out to the side so everything's all lined up and looks pretty again. So, a way to do it, but I'd say live with it. It gives you character. Gives you a good story. So definitely something to do. Definitely something you can do. Emil, how long does this procedure take? Are you talking about like midline shift and everything like that? You can kind of think of it just like if you were to get yourself into braces, and usually a very normal route or set of braces would take you about a year and a half to 2 years. So, is it worth it? Maybe. Some people it's super worth it to get everything shifted off or looking picture perfect or anatomy perfect. But you don't really have to go into it. You don't have to go that deep into trying to get it corrected. But it is something that your general dentist, your normal family dentist wouldn't do. They would refer you to an orthodontist. That's the braces dentist. But if a general dentist, your normal family dentist, was to do it, they would probably just shave the teeth into small little nubs and then put you in, and then reset it all with crowns and veneers, which is like equally as expensive. Let's see, front teeth veneers. Who would be an example? Because Tom Cruise got his stuff fixed. So it looks normal now. Before and after. Where is it? He has it somewhere here. Yeah, his midline's just super shifted. Front teeth cut for veneers. No, they're more drastic than that. Okay, let's do anterior. Have to get all real dental on it. Anterior veneer preps. What is a good one? This one's alright. This one doesn't look that hot, but we can get the idea from it. New one. So in this case and everything like that, they've shaved down all those teeth that are the offending teeth that maybe don't look pretty, maybe are off center or whatever, and then they're going to rebuild or put veneers. More likely not just veneers, they're probably going to put full covering crowns over these teeth and make them line up on purpose. So like in these cases, as we're looking at it, you're looking at potentially let's do that. Let's bring this to a lower number. So we're looking at 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. About 10 teeth that they are going to be putting this coverage on. And so depending on where you go to, let's say you go to like a standard kind of middle of the range dentist that charges middle of the road, it's probably going to cost somewhere about $1,000 per crown. It's kind of middle of the road. So at $1,000 per crown times 10 teeth, you're looking at a $10,000 smile makeover for just the front teeth. We haven't even touched anything in the back. So 10 grand, straight nice looking teeth. Is it worth it? To some people it is. To others it isn't. But you'll see those people make those choices and go for it. And it's cool on them. I've had people come in and drop $14,000 to get, what was it, like, it was like all the back teeth. Yeah, it was like all the back teeth and like a couple of, it was almost near every damn tooth, which in that patient's mouth was probably like 20 teeth to get all prepared, whittled down just like these upper images. And I think she dropped down like $16,000 to get it all done. And my goodness gracious, she did not need to do that. And she kind of put herself into a wacky next like few months of just pain and certain things that would come from it. And that's just because of how that doctor worked and prepared and did all this work on their teeth. Well, just hearing makes my wallet scream in agony with those prices. Yeah, it's kind of insane, especially here in the US and everything like that, where it's going to be really expensive. So that's where you'll hear people be like, oh, just go down to Mexico and you can get that $10,000 procedure for maybe $2,000 or so. And they're, for the most part, using all the same stuff. It's not like back in the days where the equipment and all that stuff was too expensive to reach. These days, it's a lot more easier to have similar to same quality on from a lot of different countries and everything like that can get their access to it, as long as they're going to a true dentist that has an autoclave to sterilize the instruments between patients. For the most part, it can be safe. It's just the material might just be made out of different stuff and everything like that. So, good questions though. Hopefully I'm not freaking everyone out and the prices are definitely not friendly. But that's the best thing about being a dental assistant. When's the Roblox gameplay? Fool, I know you've been waiting for those Roblox. I know you're just salty because you got clowned on in class because you got hit with 80s stuff. And you brought that on yourself. Just to say, it wasn't in the back of my mind that I was just gonna throw that out there to you, but you played a little bit too long on that one. Oh, that was fun. When's the Roblox gameplay? But yeah, cool. Let me go back and do this. In the EU, Bulgaria specifically. Oh, I've had a couple of dentists join in on this chat that's from the EU and everything like that. Sometimes dentists will delay your wisdom tooth treatment until you're 18 because it's insured and they can't get money out of you before then, no matter how painful it is. That is a very interesting thing to know. They kind of have that same type of deal here when it comes to like crowns and implants, because your they have that because your anatomy, your bone structure, your skull is still expanding and growing. So until you're roughly 18, which also insurance won't pay for anything before then, that's related to like crowns and everything. Um, you're kind of out of luck to get that restorative stuff, which it's not too common that you'll need an implant or a crown at 18 years or before. But some people that like knock into their teeth and it devitalizes, it dies, like at 12 years old, 13, because they played sport, so they got hit in the tooth with a hit in the mouth by a ball or something like that. Your teeth can die, and at that point, they still have to wait till they're 18 to get insurance to cover. But of course, you can always cover it with cash if you have it. You had one good joke today, and it's very rare, but I'll give it to you. Yeah, I pride myself. I'm still thinking about that joke, Cora. You got any recommendations on? You got any recommendation on those that have ticks that need chew? That have ticks that need. Let's see. My thing's a little blocking it. Okay. I was trying to think. I was like ticks that need to chew. So like a habit. You have those people that have habits and they're chewing on stuff and everything like that. That have nervous. Yeah. Good question when it comes to that. As far as nervous habits and everything, as far as it chewing, as long as whatever you're chewing is not, as long as whatever you are chewing is not detrimental to your tooth. So, as an example, it wouldn't be good to be like constantly chewing on like sugary things or anything like caramel or anything like that. Another one to not that's not good to chew on, like everyone will say, ice. Specifically, if you chew on ice, it's going to cause your teeth to constantly shrink and expand, shrink and expand. That's just the nature of just materials in life, expansion and contractions. But watch out for certain types of ice, like clear ice, like super like see-through ice. Those things are super dense and hard. Don't chew on that. But if you have the natural crushed ice type of deal, that's fine for the most part. But it could lead to teeth fracturing and having issues with lead to teeth fracturing later on down the line. There's always a potential. But if your teeth are nice and hardy, they're well taken care of. You brush, floss, mouthwash, good fluoride every single day. You should relatively be fine. But I mean, there's people. I mean, they'll just like get a toothpick and just chew on it, and eventually that could lead to minor little fractures that can cause a break. And I mean, it's time to take care of it at that point. A lot of ways that people tend to get away from that is to, if they have a specific item that they like to chew on, to pepper it or throw an edible substance on it that you don't like. As an example, like Tabasco sauce, Tapatio, something that's really bitter, to not salt, but to powder whatever object that you like with a bitter substance, so that your brain starts connecting. That's not that good to chew on or anything. Me too. Hans, me and Denise and I were laughing about it when we hung out. That's funny. Can you please give suggestions on how to remove dental cement after placing temps or permanent cement, placing retraction cord? That's a good one. Let me read below and see what else we have there too. I chew on those placker tooth. Oh yeah, those toothpicks. Yep. Really often and have broken my tooth from it. I still chew on them, but it's really hard for me to not chew on that at that point. Yeah, because every time you go and chew and everything, you're causing a little bit of a flex to happen, and it's like going at a piece of metal, or like what I think I should have one right here. I have just pieces of metal and everything, essentially like a like a staple or something like that, because every time you go and flex it back and forth, back and forth, back and forth from the chewing, you're eventually going to have these micro cracks that expand into larger fracturable cracks, and then you go on from there and such. But habit wise, I mean, everyone has a nervous tick. Sadly, yours can be destructive to your teeth. A way to kind of curtail that, and this is an expensive way to do it, is if you have a specific spot in your mouth where you're like, I'm gonna throw a toothpick right there and just crunch, crunch, crunch. It would be beneficial for you to get a crown on top and a crown on bottom right where you do that crunching, and you just specifically keep it to that spot, because your teeth are like chalk rubbing against chalk, and it will eventually rub each other till it's gone. But if you have a crown on top of another crown and you rub those two together, that's like rubbing two rocks together. They're not going to wear out as fast as chalk against chalk. So that's a way that we keep people from grinding their teeth, is putting rock right up against each other, and now you don't have as easy as ability to wear your other teeth around there. That's what I'd recommend, especially like you mentioned that you already have a tooth that you broke. That's going to probably already need a crown unless they've offered you a filling. So crown that sucker, potentially crown the one that's below it, because it's going to be in that same avenue, and then just keep it to that section, that area. Any suggestions on dental cements? Okay, Danny, that you mentioned here, dental cements and everything. It goes back to our floss. I got a big old spool of it, so kind of standard, have to have that. When you are removing dental cement, I do need a scissor. I know I have a scissors around here. Oh, I have something I can always cut with. Nail clippers. Don't judge me. Always have nail clippers nearby. Super handy, super helpful. When you do have your piece of floss and everything like that, when you are going into removing dental cement and everything, what I like doing is tying a knot in the floss, which I'm pretty sure your teachers, your instructors are going to be showing you. But tie a little knot in there, so you have in your whole little floss set one specific nodule that when you get it into the teeth and everything, as you pull through, that knot is going to rub into that gum, get past, and it's gonna whack all that cement on its pass into the tongue side, into the cheek side. So knot it up, bam, 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 bam. You should be able to get dental cement out from interproximal that way. It's kind of the main one, because those are the difficult pieces to get right. When placing temporary or permanent, crown, yeah, I would say just do that. When you do place your cement into either permanent or temp crown, and us in California as registered dental assistants, RDAs, we are able to remove that with the doctor not being in the room. So of course we're unsupervised and we just got to do it. Let the cement set up a little bit. Don't try to remove it too early. Let the temporary cement or permanent cement set up just a little bit so it's a bit firm, and then it'll just peel off. It'll click off super easy compared to it being still gooey and having to try to rip and wipe that off and everything. Wolf over in Twitch mentioned, so is it important to brush our teeth every morning and at night? Let's say that, of course, okay, let's start off with, you should always brush after every meal. A lot of people default to just brushing once in the morning and once at night. Let's say you only had the opportunity to do one of those. Oh, cool. Thanks, Arden, for subscribing and everything. You're awesome. Always here in case you have any dental questions to ask, and hopefully am helpful to be able to do that. Back to Wolf on that one. Let's say you had to choose one. Someone put a gun to your head and said you need to brush or floss one time. At that point, I heard that clicking like on the stream will prevent tooth decay. It's stupid. Oh, Flu, you're too much. The best time, if you were just going to... Hey, David! Oh, do I not have sound? Oh, that's very weird. So something else. I think I have sound. Anyone else, let me know. Unless it's like a turn up the volume on the device type of deal, or maybe it's just low. That's on your end, David. Oh yeah, there you go. So look, the best time if you are going to just brush and floss is at night. Main reason is because if you do have all that plaque, and if you have all that plaque and calculus and germs on your teeth, you don't want to sleep for that 8 hours time and let it just cook on your teeth. So the best thing to do is to brush and floss right before bed, then let everything be cleaned the whole night. And if you don't eat anything, and if anything that you do is just drink water, when you wake up in the morning, your teeth should actually still be fresh enough that you didn't really build up sugary germs. And so without that sugary germ buildup, you actually don't have to brush in the morning. You can just throw a little mouthwash in there, get it just to be a little bit fresher, and you're good to go. But a lot of people don't run that way, and a lot of people like just brushing straight in the morning and not at night. And so choose your poison. I recommend at night. If you're gonna do one, just do it at night. If you can, get it in between meals. A good thing to do, actually, to kind of help for those in-between meals plaque removal, apart from just, like I mentioned before, just having floss always there, a little bit of gum. If you get some sugar-free gum, Trident, Orbits, anything with xylitol, usually as an advertisement it'll say xylitol, sugar-free with xylitol. It's XYIOTOL, something like that. And you use that and you chew on that after like food. Like if you eat breakfast, you eat lunch, probably not after dinner because you're going to be brushing anyways. That's going to help get all that 3-surface plaque off. But the in-betweens, that's where you still got to floss and everything. What is up? Go. Yep, I'll be right there. Danny, also, do you have videos on ortho procedures? And also, do you typically use Fuji cement gold crowns or PFMs or porcelains or zirconia crowns? You just have all the dental knowledge. I like that. Are you still in school, or have you been out there for a little bit? I would imagine. So sugar-free gum can help clean the teeth. Like Trident. Yeah, Trident. Yeah, I probably didn't mention Trident. Trident's a good one too. Using any of that can help between brushing and such like that. Danny, if you stick around for just a little bit more, I will be right back, and then we could talk about ortho procedures. I do have videos on that, though. Let me go and see if I can get one of them up here on the channel. For ortho procedures, the main things that I have as far as videos are... Let me get to my channel here real quick. Let me get to videos. And I have one for putting elastomeric ties on braces, and I think that's the only one I have. Really? I thought I had another one. Oh, and spacers. Yeah. So I have one for this, which I'm going to get set up real quick, and then I gotta go and do something really fast. But I'll be back here in a moment, not too long. Oh, sorry about that. Let me get this up here in just a second. Windows capture. Add existing. Mirror capture Chrome. And that's where I have this video for changing braces and everything like that. Thank you for the bless you and everything like that. But I will be right back. I'm gonna kind of let this run for a little bit, and and the videos on DAs, and videos on DAs using the Profi Paste. I forgot. I do have a Profi Paste one also. or how to do what was it called? Pro coronal polishing. So I'll be right back. Just a moment. I just need to make a quick thing to do real quick. The ring that's inside exposed with our orthodontic pliers. We're going to start with taking the ligature, wrap it around all 4 posts in a circular type of motion, click your ortho pliers to release, and move on to the next one. Moving on to figure 8 ligatures, we're going to grab our ligature tie, and we're going to start by lacing it around one post, moseying it over to the second, and instead of going over the third, we're going to tuck one behind and leave the other part of the band going over the 4th post to create that figure 8 shape. Snag one post and go over 1 and 2. Tuck it under the 3rd post as you go over, and then go over the 4th post to create the figure 8. Removing the ligatures with a scaler or an explorer is fairly easy, accumulating all the ligatures on the neck of the instrument. The next form of tying down our arch wire is going to be with the use of a power chain, which is just an elastic ligature, just a bunch of them chained together. For the power chain, you're going to go and link it onto the teeth that Doc mentioned so that we can put extra tension and pull onto them. A power chain may also be linked to a TAD or a temporary anchorage device to facilitate movement in certain directions for teeth that we might want to expose, such as canines, or alternative pulls and pressures that we want to apply to the teeth. As it comes to removing the power chain, just as before with the elastic ligature, go and take a scaler and remove the first one, and it's a simple up and down movement so it seesaws off of the brackets. Be sure not to put too much tension on the brackets so we don't pop off a bracket or put too much unnecessary force on the patient. Next, we have our wire ties. By simply putting a bend at the edge, that will help us to go and wrap it around the posts of the bracket, which then we can go and take our orthodontic pliers and start twisting with a gentle pulling pressure until it is taut and secure around the bracket posts, holding the arch wire down. From here, we can go and then take our wire cutters to cut about 2 to 3 millimeters off so that we can go and gently tuck that around the wire. Using a wire director or an instrument of your choosing, go ahead and bend that around the back of the arch wire. Always remember to check the tuck that you just did with your gloved finger to make sure the patient's lip doesn't get caught. Another tuck that can happen is if we tuck it around the bracket post that we tied around earlier, and make sure to always check that if there's any pokes. To remove, all we have to do is untuck, unwind, or we can go and untuck and cut at any of the little exposed wires of this wire tie. Now that we have our arch wire ligated or tied down with our wire ties or our elastic, and we feel for the arch wire that sticks out past that last tooth that it passes through the band. Taking our distal end cutters, we will maneuver ourselves towards that wire, give it a clip, hold it, and then remove it from the oral cavity. Check the leftover arch wire to make sure it doesn't poke your patient's cheek. Thank you for reaching the end of the video. Check out other videos like how to polish, seal, or even my interactive dental amalgams video. Apart from that, take it easy and have a good one. Alright, I am back. Oh, it did end. Oh, that's a short video. Oh, weird. Okay, questions. Do I have a corona polishing video? Yes, I do. And I believe... dental amalgams video. Apart from that... Oh, this was the other one that I had, which was... and I don't even think you guys can hear it over on your side, or it might be really low. Let me bring this down so you guys don't have to hear two of me. Yeah, this one's for placing separators, specifically when we do separator placement and everything like that to get teeth ready for braces and everything. This is a common one. I go over do's and don'ts when it comes to specifically this portion, and I show even like alternative ways. Like this is with like an ortho separating plier, and then of course we know how to do it with the floss. And then I even thought of a new technique to be able to floss these in there, but like 8 at a time instead of having to reline the floss into into the separators and everything all the time. So that's another one that I have. You mentioned. You also mentioned coronal polishing. I did make a coronal polishing one, and that one was, when did I make that? Should be somewhere within this range. Oh yeah, polishing teeth away. Polishing teeth. What is it? I forgot what it is. Pray away the stain or something like that. Oh, this is when I got a little bit more crazier into video editing. So this one, it's cute to me, but I kind of overdid it with some of the editing when it came to it. But yeah, so I got polishing and everything, how to do it, how to assemble all that nonsense. So that's always there. I've gotten a good amount of dental videos kind of covered, and I'm still always making new ones. So I'm trying to get into some repair stuff. Right now I'm currently working on a like making bleach trays and night guards and everything on a vacuum forming machine. So that's also something that that's in the works and such. You mentioned earlier. Okay, yeah, ortho video is cool. And do you typically use Fuji cement on crown? Yeah, Fuji or glass ionomer is the typical cement that we tend to use. Many offices tend to use everywhere. Fuji is awesome stuff because it has the ability. It has that fluoride releasing ability. It soothes the tooth because of the fluoride that's usually in glass ionomer or Fuji cement. So it's just awesome stuff overall. And usually we use it over all these. I think they don't recommend using Fuji under zirconia crowns because zirconia crowns are difficult to bond, or you have to bond zirconia crowns instead of using cement. But it just depends on what material you use and everything. So that's always something to kind of think about. But your doctor already has that all. Your doctor will already have all that figured out too. And then you mentioned earlier on cord packing. Here in California, as a dental assistant or a registered dental assistant, you can't pack cord. You can't pack cord, straight up in general. But we do have another, apart from the two that I mentioned, that's above them, which is called a registered dental assistant expanded functions 2. Bunch of different letters, and they are allowed to pack cord. So I typically don't teach on cord packing, but it's not hard. It's not hard to do. It's not difficult to do. With the right hand, right steady hand and know-how, it's super easily doable. But I know like in Nevada, a dental assistant can pack cord with the dentist being directly supervising, as long as the cord doesn't have a chemical agent on it. So that was one of the main things, is that it can't have a chemical agent on it, and it can't have a chemical agent on it, and it has to be supervised. But yeah, pretty easy stuff. And then cord packing for that in California, what can you do or not do as a DA? Good question. Tons, or I should say tons. A lot of it comes down to. Could you watch Oliver Enters the WAP Actor? Yes, Robbie. Last time we tried to watch that, and I think my computer froze and crashed or something like that, or my kid was sick, so I had to go get them. But we'll take a look at that. I think, because I didn't watch anything of it, but I think when we brought it up, it was like something about like this cute bird or something like that. Yeah, I haven't watched it, so don't worry. It'll be a first live reaction when it comes to it. Danny, what you mentioned before with in Cali, what can you do and not do as a DA? Dental assistants can do on ostrich. That's what it was. In California, like a dental assistant can do a bunch of stuff. They can do a lot of different things, but it just comes down to, for at the base level, that they need supervision. So doc needs to be in the operatory, in the room, while the assistant is doing it. So like an example, a dental assistant can take a bite registration. They can use that little blue genie blue bite gun and put some of that goo on the occlusals, have the patient bite. Then DA can do that. Doc's in the room. But if you become an RDA, then when you become an RDA, you don't need doc in the room anymore. So it's now general supervision. It's general supervision at that point. And let's see, what was that called? Olive enters the wow factor. And another one would be at that point where, oh yeah, I forgot this one's cute. The first one. When it comes to other things, is like one of the things that DAs can't do is like placing bases and liners. So placing a die-cal, placing a die-cal, or placing like IRM into a tooth, because they're considering that as a temporary thing that could leave with the patient. That's not something a DA can do in California. But if you're an RDA, then you can place a temporary filling. You can place die-cal. You can place base. You can make a crown and place a crown. DAs can't make crowns here in California. An RDA has to do that, and then an RDA has to cement it. But only RDAs can cement temporary things, not permanent stuff. But we can remove temporary cement and permanent cement. It's a big old thing. So there's a big old list. I mean, you really deserve a raise as a dental assistant, not gonna lie. Thankfully, we're just helpful. By the way, you heard of a hard to rain in Los Angeles? It's raining hard. And you heard, yeah, the hard rain. Yeah, the rain's coming down all over California, but definitely down south, they're getting crazy flooding and rain and everything like that. It's raining hard in Santa Monica. Interesting. Let's see what this ends up being. Let me get my thing up. You said the first one, right? And this might even be cute, where I can go and throw this up for my kids. Little zoo, that's cute. Let's see, is this in frame and everything? Cool.
She lives with her family in the outback.
This sounds familiar.
Very different. Olive's dad loves to run. Olive isn't a fast runner. Olive enjoys laying huge eggs. Olive doesn't like the look of that at all. Olive's little brother pecks at the ground to find tasty roots to eat. Pecking at the ground makes Olive sneeze. Olive has an incredible imagination. So while the rest of her family are running, pecking and laying eggs, Olive can be found imagining herself going on amazing adventures.
Oh, this is totally up my kids' alley. 2 little girls, so they'll love this. Is there more to this one? Oh, yeah, because it looks like it's a series.
Until she popped up somewhere new. Olive was standing by a stage in a television studio with a cheery
The voice kind of, except that it has like, I don't know if it's a British accent. Seems like the same voice actor or voiceover person for Pocoyo.
Olive could see 3 judges.
Neat art style. This reminds me of Kablam from back in the 90s.
A terrible performance, absolutely awful.
The crowd began to boo. Super Feathers did not look happy.
You sounded okay, but the other one, my pet cat has a better singing voice.
Yeah, it does sound like that dude, doesn't
If
it?
you've got any chance of winning the wow
Actually, oh, you said Pocoyo's narrator was the same one from the same as the Planet Earth one. Oh, so there, and it's funny that you kind of that you caught that too with the Pocoyo stuff.
How's it going,
Oh, Tracy, what's wrong with your voice?
got this cold, haven't I? Can hardly speak, let alone sing. That's why we gave such a terrible performance. Never gonna win with Tracy sounding so rough.
Olive looked down and saw that she was wearing the same pink costume as Tracy and Stacy.
But
My pink costume? Your pink costumes? I think I may have an idea. I could join Super Feathers and sing instead of you, Tracy.
I'm gonna have to show this to my kids. I'll put it on in the morning. They all like to wake up at like freaking 6 in the morning with me, so I can put this on for them.
Stacy and Tracy got to work teaching Olive the song and the dance routine. It was hard work, and Olive had to learn it really quickly. Very soon there was a knock on the dressing room door.
Super Feathers, you're on stage in 2 minutes, darlings.
Okay, you ready, Olive? As ready as I'll ever be.
Olive and Super Feathers began their
He just reminds me so much of the Pocoyo narrator, but it has this little accent on there, but it's cute.
At first it was
I love Pocoyo. It's super cute show.
and Tracy mimed along to the words. But as Olive danced, she got so carried away singing the song that she went in the wrong direction and she danced right off the front of the stage. Olive went flying and landed sitting in Moo Man Cowbell's lap. He looked completely shocked.
What do they call him? Moo Man?
Carried on and
Well, Simon Cowell, so Moo Man Cowell or Moo Man something.
That was an utterly, completely, totally amazing performance. No one's had the courage to jump in my lap before. Super Feathers, you are this year's
Super
Wow
Feathers.
Factor winner.
Thanks, Olive. You really saved the day. Yeah, we're all gonna be super famous.
It's funny how they're just using like just a bunch of just craft stuff to be able to make the rest of the character versus Olive.
as they did, Olive realized it was time to go.
Oh,
Typical Olive daydreaming again.
Said Emma.
Actually, I hope the Super Feathers win Wow Factor.
It's been in the sun too long, dear.
Said Olive's dad. Her little brother laughed. But Olive wasn't listening. She was already dreaming of her next big adventure.
aw. I'm gonna have to save. I'm gonna have to save this one. That one's cute for the kids. Let's see. With the Super Feather Girl, I didn't even go back to see the chat. Did you see? I heard that your smaller baby Tooth started school. Congrats! Yeah, the little baby. Little baby Tooth went and started preschool, daycare, Head Start, whatever they would call that, and everything. And she's been doing all right. Let's see. I found it for my son. Actually, Pocoyo's narrator was the same as Planet Earth one. Tracy is you. Tracy is you. What is it? Oh, look, she got the whole thing in there. I might have planned that act, even if it was an accident. The lap incident. yeah, the littlest one. She cried. She cried her first day, but then she kind of cried today on leaving. She'll get better as we go on from there. What was it called? What was I gonna say? I should try to make something kind of like that, but I already have my plate super swamped with video ideas and everything like that. But it would be nice to make a couple of videos that specifically pertaining to like kids and brushing and flossing and all that. Shoot, I have a tooth costume. If it wasn't so terrifying, I'd probably be doing it in that aspect. It was a late night. Dental Things was asleep in bed. Super Feathers came to the room and scared him out of bed. Oh, look at you. You already have the rhymes going. That's fun. Yeah, because I remember you. Remember last time you brought up was the last time you brought up was what was it? Stop, read, sing, or something like that. It changes everything, and then that was a first 5/8. Yep, exactly what it was. Yeah, so it definitely you have that either the birds, you have that affinity to the child development side of everything and everything like that. And just like you mentioned, you found olive and everything for your kid and everything like that. It's good to have those content. One of the cool things, which I like Bluey, me, my kids, my wife, we all like Bluey and everything like that. Super adorable. And we just realized or found out that when they have their next anime convention, I think they're going to be going to the anime convention in August, this year, and me and my wife are super ready to go to that. It's just the voice actors for Bandit and Chili, the mom and dad, and me and my wife are super stoked to want to go and see that and go and see them. But that's gonna be a fun thing when that comes around. As soon as those tickets come out, I need to snag them up for those days that the day that they're gonna be there, so we can get their autograph and meet them. It'd be awesome. That's definitely what it is. I'm saving up to go to the USA and see the Star Wars theme park. Star Wars theme park, the one in at Disneyland. At that point, it's super cool. I didn't know you were into Star Wars. I'm pretty sure they actually have multiple. Like, I don't know if they have one over at Disney World over in Florida, but Disneyland in California, where Home Dog is at, that's pretty cool. And then Invader, me and sister are going to visit you guys Thursday. Thursday? What's happening Thursday? It'd be cool still anyways, right? Company and everything. Yeah, Disney. I think because I'm not a super fan of like Star Wars and everything like that, me and my wife really haven't put any time into it at all. The last times that we've gone to Disney, we kind of don't really mingle over there. We went to go. Last time we went to California Adventures, the one across the way from Disneyland, and it was not that great. Well, we weren't really there all day to do stuff, and we didn't go on any rides. We kind of just like walked around and looked at the Marvel's campus area, and that was cool. I'm pretty sure if we actually stayed for rides and put some effort into it, it would have been cool. How many Disney parks are there in America? I reckon that there would be Disneyland in California, California Adventures, which is right across from Disneyland in California, and then Disney World, which is Disney Epcot, is another one that they would call it. That's over in Florida. I think that's it. And then like over in the EU's region, what they have Disney Paris or something like that. I know they have Hong Kong Disney, and there's like two other ones probably out there in the world. I would imagine. I know some of them have like cool things. Like I think Hong Kong Disney might have Zootopia stuff, and then I don't think there's a Japanese Disney. I doubt there is, but there probably is. Who knows? I know there's that. I know one of them's doing like Moana. One of them's doing like Frozen. I forgot which one is doing Frozen. Ours over here is like taking out old stuff and it's making. I think they're doing Princess and the Frog, the Bayou area. They're changing that one up. Huh. I need to go and log every day. Yeah, I was about to say, I'm pretty sure the whole Frozen one might not be your anything new or cool for you or anything like that. I'll be right back. I need to go log into something real fast. So just poking the patient's tissues. Make sure to protect your patients by fulcruming or finding support spots so you're not giving them unwanted piercings. Make sure to watch out when you're removing your separators not to send it flying towards the opposite teeth or tissues, accidentally impaling your patient. Be sure to not give them any new dimple, snake bites, or throat piercings. Another way of placing separators is by taking 2 pieces of floss. There's no need to make them too long, just get 2 flosses at arm's length. Begin by threading the floss through the separator and holding that floss end to end. Take the second piece of floss and also thread it, hold the end to end, and when you go and pull those 2 individual pieces of flosses, it should stretch the band. Go ahead and tie it around your fingers so that you have a good stretching ability and you can press with either your index fingers or your thumbs. Beginning with your separator, making sure that it can still stretch, go ahead and wrap it around your fingers for support using your index or thumbs to go and seesaw into place so that part of the separator is under the contact. Go ahead and hold the separator in place and pull one end of the floss to remove and leave the separator. Go ahead and do the same for the other side of the selected tooth. A little more of an advanced technique where you go and get all the separators that you need and 1 piece of floss. I'm going to unravel my floss bow. This floss piece will be a little bit longer than the previous ones that we tried. We are now going to tie a knot twice at the end of this floss, making sure that it does not unravel when we do this technique. We can then thread our floss through as many separators as we need so that it is locked into the floss. Now that you have as many as you need, your pinky will hold the rest of these separators in place so they don't fall off. And we are going to then use our fingers, making sure that our separator still stretches. We're going to transfer over our fingers to make sure that we can stretch it with either our thumbs or our middle or index fingers. Lock it into place, get it down. After placement of the separator, then we can pull the whole piece of floss out, go and take another separator and line it up, and then get ourselves moving on to the next tooth without having to refloss a whole set. This makes it easy to be able to do multiple teeth in one go. If you don't have access to separating pliers and we want to keep this really disposable and quick, we have this method.
Hey, that's pretty good.
Another neat technique is using a hemostat or locking plier that holds onto the separator really good. Floss the thread through the separator, and you can go by pulling the whole band underneath the contact and then lifting upwards to set the separator in place. This method might be a little bit more painful as there's not as much room underneath the contact, so watch out for your patient's pain tolerance. Thank you for sticking around with the video. Hope you enjoyed it. Like, comment, and subscribe for more dental things. Back, hopefully in time. Long time no see. He just dipped. That's fun. He had to take care of something that was real fast. Very educational waiting video though. Look, like magic. Toothbrush. Oh, that's so funny. Cool. Yeah, these little videos are my pride and joy, right? They definitely have kept me busy and such. Whether they be my weird ones like my nightmare videos or any of these other ones that I've worked on. I should be really pushing out way more than I have. But that's always good. Let's see, we had someone else. Can you please go over implant delivery sequence steps? Toothbrush, I like that. Hold on, how the hell is there a toothbrush emoji? I never even thought about or looked at something like that. Alright, cool. Can you go over implant delivery sequence and steps, and how come some anterior fillings do not require doc to use LA local anesthetic? I think that's what you're kind of referring to, in there. Okay. Implant steps and delivery, as far as it going into that aspect, and for that I can actually go into. How do I want to do this? Let's go and close, or let's go and bring down the Chrome, and let's go and do a new one. Or no, not new layer, just new in general. Actually, let's do a new one that's. Let's do. I don't. How to do resolution? 1820 by 10. Oh no, 1920 by 1080. 1080. Cool. Big canvas that I can use at this point now. All right, so we got implants that we're trying to do. So in certain cases, of course, we have, and I'm going to be terrible at this, we have teeth, and of course, I'm bad at drawing roots when it's on my laptop trackpad, but we got something going and everything like that. So normally we have tooth and we have roots and everything like that. But we have tooth right there, and let's say that we have this tooth here, boop, and this is a premolar, single roots and everything like that. We have gum lines that we have, and I'm going to do the gum line in, as I can possibly do it, pink. No, let's do a new layer, and the gum line will be pink, and it's going to ride this section, and boop, and boop, and it just goes on from there. Everything from below that is going to be bone, which we will do bone as a section that I can do right about here, and we are going to do this. I don't even know how to find where the hell brown is. We're going to do this lightish brown. We're going to do a bucket tool, boop, and we got to bring this sucker all the way down. Shoot. S, this, magic S, remove everything else, and then we'll do a background layer, which is going to be white specifically. Bucket tool. Alright, cool. I'm glad that I can be quick to the draw on this and everything. Alright, so we have tooth, we have gums, we have bone. And so in that aspect that we have all of those factors in here, let's start the implant procedure. Doc sees this tooth and they're like, hey dog, you need to get potentially an implant. I'll do it in gray so it's not so bright. Yeah, I'll do it in gray so it's not super bright white. Cool. So, hey dog, you need to get an implant. So, alright, doc, well, what is that going to entail? Well, let's go ahead and start with preparing the site which the implant's going to be at. So they go and take their drill bits. So they're going to take a small, they're going to go, or I guess let's start with this first. They're going to need to cut tissue. So right off the bat, they need to cut tissue. That means they are going to go and take a flap of our tissue that we have here, and they're going to go and pull it back and open it like a I would say like a popcorn bag. I don't know why I'm thinking popcorn bag. Just go with it. And so they're going to go and pull that gum tissue away, and we are going to have. Why am I not getting that specific one? I drop tool. Cool. There we go. All right. Brush. So now they're going to get their gum tissue pulled back that direction. They're going to get pulled back that direction. And now we have an empty area right here where we have access into our bony structure and such. So now that our gum tissue is now out of the way, now they're going to go into step drill stepping into doing the implant. Especially, this is all specifically aiming for the lower. So another thing that we need to watch out for here is a spicy little area that is going to be need to be watched, which I'm going to do in blue, which is going to be our inferior, alveolar nerve, which generally travels somewhere along that line. So our I, inferior, A, alveolar, and nerve. That's what our EN is all about. So back to the implant. Your doc is like, okay, we're going to go ahead and start doing our implant portion, which I'm going to do in white. Actually, I will do it in yellow. And so the implant, they're going to do it in steps. They're going to use a small little pilot drill, and that's going to drill down and establish angle or direction. And so Doc is going to first do a directional drill, and they're going to go and analyze it and plan it out. And once they make that first drill into there, they're going to have an x-ray be taken. A lot of times they're going to go with the next step, which is going to be using something that's called a paralleling post. And that paralleling post is going to be an indicator when we put that in, that's going to say, hey, with this thing sticking out and it going down, are we establishing the right angle of insertion? And if we are, cool. The x-ray will tell us if we're on the right path. So let's say that does happen. So Doc is like, okay, we're going to go and move back into drilling. So now that we did a first step as a pilot drill, we're going to go and expand and do our next drill. And that's going to be a little bit larger. And then they're going to go step on that again. They're going to say, okay, larger, keep going. And then eventually they're going to get to a point where they're like, all right, this is as large as the hole that we want to go without it getting close to the side teeth that we have here. So now now that we have the hole the right size, let's establish a threading to it. So now they're going to go and use a specific tool that's going to add a conical like thread to it, and which I'm going to do here in light blue. Let's do it in green. And those threads are going to start developing around the edges of our piece here. And so now you're going to have a screw-like look to it. And it's going to go all the way down to a point. And it's going to get fairly close to that inferior alveolar nerve, but it's not going to hit it. Cross our fingers and everything. So awesome. We have, I love the thoughtful color selection. Thanks, Nora. So now that we have that, we've established depth, we've established girth or width, and we established angle of insertion. So now with all that, the last piece to do is to go and thread very slowly that titanium implant into place. And as it goes down further and further, Doc may say, hey, go take an x-ray of this. Okay, good, it's angling right, awesome. So now the whole area of this tooth is prepared, and let me go and take that all away, and that one can stay, whatever. Let's do this. Let's color. No. Oh, hold on. What am I doing here? That. Okay, that doesn't work. All right, whatever. So now we have our implants in place. And since our implant is not made of tooth structure, it's not made of bone, it's not made of anything, it's made out of metal, I'm going to make it as a metal screw. So we're going to go and do this portion, and now that metal screw has gone all the way down, and it's pretty low, and it's got that cone-like spiral to it and everything. This bottom portion that's inside the bone is called the endosteal placement. The endo, inside, osteal, bone, placement to place. And so now we have that place in there. Usually that's going to range somewhere within like $3,000 or so at like middle of the road dentist for just that placement. And now that we have it placed, doctor's going to torque or use a torque wrench, a specific little tiny one, and they're going to torque it till they get about 32 newtons of force, where that's enough that the bone that's in there is holding on to it firm enough, and it's not going to spin on its own. So that's kind of step one as far as placement and everything. Step two, or I should start. Okay, we got the X-ray. Everything's we got the X-ray. Doc says, all right, let's go and place. Let's go and sew up or suture to put a stitch these gum tissues back in their place. So that's where we're gonna go all the way back over into our other things. Let me get this color. Nope. Of course, this doesn't work like Photoshop like I usually like it to. We're going to go and stitch up these gums. So now we're going to go and place these over right back. We'll add a small little thing of suture material. And I'm going to make mine, oh, of course I have it in gray already, so that's not going to work. We are going to do ours in dark red. And so now I have a stitch with a little knot and a little tails and everything, and that's going to stay stitched up for about like a week or two or something like that while this heals. On top of this implant, there's going to be something that's called a sulcus former or a gingival former, sulcus former, healing cap, bunch of different names for it. That's going to be a lid for this, so nothing can get inside of there, because where this yellow part is, it's hollow. That's where we're going to be threading a lot of things into as we place them. So cool. That is step one. Doctor's going to do a bunch of different revisits. Hey, how's the implant doing? They're going to check it, see if it's still torqued right and everything like that, see if everything works well. And you're going to sit with that implant for about 3 to 6 months so it can heal, so that the bone can do something that's called osseointegration, and the bone wraps around and tugs and holds onto that implant really tight. That's usually where we want to get to and end on. Let's say 6 months passes. Now, cool, let's go ahead and do that same thing where we went and reopened up those gums again, and we see that that implant is now sturdy, it's not going anywhere, it's successful as far as placement. Osseointegration is perfect. Now we're going to go add a second step, which is going to be doing a implant, a custom implant abutment, which is going to be the middle part where we were talking about that yellow hollow section in the middle. Now we're going to go and put that in there. I'm going to do this in blue. And that implant abutment is going to sit above this implant portion. It's going to thread into that bottom center section so that it doesn't come off and doesn't come apart. And the doctor is going to prepare this abutment to be a small little thing so that we can hook stuff onto. That is our prefabricated implant abutment. And this is where things get fun, because now that we have the abutment there, now we can go and do an impression on this. Send that impression to the lab. The lab can make a crown specifically for this implant, and then it comes back to us. Now this is where things start getting quicker. The implant abutment, that gets put in there. A dental assistant will make a temporary crown for that. They'll wear that for a couple weeks and such. And then the lab makes the crown. The crown comes back, it looks nice, and that's where we're going to go and make that crown fit on that tooth, and it's going to be level with everything else. And now we have an implant supported tooth, and at the end of this, that patient paid somewhere between $5,000 to $6,000 to get that one tooth restored where that tooth was missing. So a lot of different steps. Humongous bill as far as like what to pay for. Implant supported teeth, look at that. You got, yep. And so usually it comes down to three procedures, which is, like I mentioned, endosseal placement, implant supported or prefabricated abutment for implants, and then the last one would be porcelain fused metal or porcelain ceramic substrate implant supported crown, essentially. But now you got a tooth, and and it functions really well. It can't get tooth decay. The worst thing that could potentially happen to it is it can get calculus buildup. It can get tartar buildup, and that's the main killer of implants. Is that the bone, the brown part that's underneath, if that starts to wear down and wear away. Let me go back over here. Let's erase, and if we start getting implant bone loss, where now that implant's not being supported around here, now that's where we're going to have mobility. That's where we're going to have issues with that. Yeah, because that's going to have mobility issues. The bone's not holding onto the implant, so that's where that usually people find themselves in hot water for not taking care or not going to their normal appointments. Hi, I just joined. What's happening? Oh, tooth lesson. Yeah, exactly. Harrison, we are someone asked about the step process of implants, and somehow I crudely drew up an implant step from beginning to generally end in a crude version. Are you excited for Inside Out 2? Inside Out 2 is going to be super fun. I haven't looked. Do they have a? I don't like usually watching commercials because I like to experience them and figure it out as we go. But definitely, yeah, looking forward to that. Tooth lessons, yeah, Flu. You're always here to support the tooth lessons. Dune 2 is releasing the next few weeks. Gonna see. I haven't really even seen Dune 1 actually. Harrison, very unique stream, like it. Thank you. Hopefully you've found it in a very easy way where you're like, oh, I'd like to ask a tooth question. I'm always up to talking about them. They released a new poster with anxiety and fear screaming. Yeah. Oh, hold on. I think I did watch, because thankfully I think I remember I did watch this one's commercial or advertisement or whatever, because it introduced that other dude, that other emotion. I don't know if they're really emotions, but yeah, they released that one, so I was just like, oh, this is gonna be interesting. Thankfully, they didn't blow the whole concept on it right at the beginning and everything like that. Like, what was one that we watched recently? We recently watched what was it? Ruby Gillman, Teenage Mermaid, or Teenage Kraken or whatever. Cute movie. Me and the kids liked it and everything like that. But I remember when the commercial came out, it pretty much spoiled the whole thing for us. What are you explaining? What you're explaining is more or less what my dentist told me on the front tooth. Cool. And then I see you over there on Twitch chat. I will definitely get to you on that whole root canal piece too. Does smoke directly harm gums, or is it an effect of the nicotine in your blood? The nicotine that's going to be going to your blood is going to be mainly affecting your heart and the lungs and all that other stuff because of just the chemicals that go there. Specifically, the smoke that comes from the ash or comes from the inhalant is going to not ruin your teeth, but it's going to make you tartar buildup a lot quicker. And that's going to cause, like I did up here in the image, bone loss around teeth, where, as an example, if the bone on this front tooth over here gets worn away, and then gets worn away because there is a nasty little calculus barnacle right there on the side of the neck, like right here, that's the toxic part. That's the toxic part that's going to be poisoning the bone and making it disintegrate, making it etch away. So that's usually what we want to keep away from there. Sydney, I'm just going to call you Sydney over there in Twitch and everything like that. I'm getting a root canal on Thursday. I am not a dentist. I'm a dental assistant, registered dental assistant, and I've been doing this for like 15 years now. So you got any questions, I more than likely can clarify it or give you some peace of mind. How common are they? Root canals are fairly common. Not as much as fillings and everything like that. You can just think of a root canal as just a longer filling. Root canals typically take, depending on which tooth you're working on, about 45 minutes per canal. That, like in the word root canal. So front tooth 2-1. Oh, so you are from outside the States. if I would be one to guess that, because they're saying 2-1, that means you're in the second quadrant. Oh, Canada, love it. So yep, so that means you're in the second quadrant, which is going to be the top left side. Tooth number 1 being right there, that front tooth right on the left. Usually that's called the what we call the ISO system, international, or no, FDI system, Federation Dentaire Internationale. But yes, that for us here in the States, we call that tooth number 9, counting from the top right all the way to that tooth. But yeah, 2-1 for you guys. Good job on getting that number right. Remembering that number too. When it is when we deal with root canals, they go by canal on usually like how long it takes. But a front tooth like that, that's gonna probably take your doc like 45 minutes, an hour at most to be able to knock out and be done. And because it's right there in the front, super easy. You may not even need like a rubber dam. Your doctor may not even use a rubber dam to do that. So dental rubber dam placement. I gotta watch out for when I'm typing that specific word. So like as an example for like a rubber dam and everything like that would be, let me get Chrome up. So this would be an example of like a rubber dam where they would essentially is like a tooth umbrella that they would put over the tooth so that the chemicals that they use to clean it out doesn't get into your mouth, so you don't taste them, and the stuff that's in your mouth doesn't get into the canals, affecting them and everything like that. The nerve is dead and the tooth is dead. So it sounds like in the tooth and nerve is dead, you might also have what's it called? A little bit of devitalization happening. It's dead, and maybe even discoloration potentially is kind of a shot in the dark. There is an infection. Okay, so that at that point, then it might not be discolored as far as like being darker a little bit, but if infection, that's unfortunate. Was it a traumatic issue, like knocked the tooth and then it ended up dying? Typically, the front teeth don't tend to die too easy, but it happens. I have no symptoms. Interesting. Sometimes people just have dead teeth. I mean, it can be a couple things. It can be trauma. It can be cumulative trauma, where you just build up, oh, I got a filling on there, then I had to get another filling on there, and then blah, 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 blah. An abscess on your upper front tooth, and it needs a root canal and observation for at least 6 months. Interesting concept. Sometimes when it comes to that, especially with the observation, they're just trying to see, is the root canal going to be successful? One. And is the root canal going to be the main fix, or does this tooth have like a fracture that goes up the whole tooth and it goes past the portion where it would be considered salvageable or able to be saved? But cool. Yeah, but it'll be really quick and easy. Like I mentioned, rubber dam up here is a good one, but up in the front, some docs don't use rubber dams on there. They're making me take antibiotics a day before I go. That's smart. They probably gave you some metronidazole, probably gave you clindamycin or amoxicillin, penicillin, or metronidazole, whatever probably like a gram or something, 1 milligram, or 1 gram, which would be what, 4 pills? Or no, if they did 2 grams, then it'd be 4 pills at that point, 500 milligrams pill, yeah. So interesting that the dental language isn't universal from Nora. Yeah, America just developed their own thing, and then everywhere else outside of America uses FDI system. So they're always fun like that. Is it possible to improve your oral health via microbiome transplant? That is an interesting thing, Harrison, with that. A microbiome transplant. This is newer techniques than usually what I'm used to dealing with, but what it seems like is you're just trying to make the pH balance, or just even just the flora, the germs that the natural germs in your mouth, be more favorable towards you, and that can probably be something that can be done, but generally with our normal cleaning methods, toothbrush, floss, mouthwash, you're generally fine. But there are people that do like what is it called, oil pulling. That's very thing that people like doing. Dude, you are killing this self-test. Wonder what do you mean by killing the self-test? That's I can't imagine. I don't know. I think I'm kind of burned on what that way. Well, I'm trying to guess what that means, but it's probably not bad. 500 milligrams a pill for 7 days, 3 times a day. It's good that they're having you take. The antibiotic beforehand, like you mentioned. You're gonna have it on Thursday, if I believe you mentioned, right? You were testing yourself over what Sydney was going to go through. Yeah, I know, right? And you got most of the things right. Yeah, it tends to happen. Yeah, so I started Wednesday. That's smart. Usually when they give that, that's going to be great because 3 days before you usually get treatment, if you're already on the antibiotics, honestly, the juice, the antibiotics are in your bloodstream. It's going to make things easy. Is the tooth painful? One thing that's probably great is the tooth painful? Beautiful. Your root canal is probably going to be super easy. It's what we call in certain situations where we have teeth that are infected and painful, we call them hot teeth. And that means because it's a hot tooth, as soon as the doctor goes in there and drills into the canal cavity, there's so much built up pressure and the tooth is so hot that even anesthetizing, doing injections in that area, it's so acidic that even our injections are not going to take, and it's a tough way to numb. But I've had root canals before, and on one of them it was painful, but then the pain went away, and then when the root canal got done, it didn't hurt. The other one, I just went in for a filling. It ended up needing a root canal, and because it wasn't painful at all, it just felt like a longer filling. So, just like you mentioned, I couldn't feel the cold test. That's awesome. Just like they told you, oh, put it on this tooth. Raise your hand if you feel it. Okay, I felt that one. Put on 2-1. Oh, what? You're not raising your hand. Are you sure you don't feel something? Yeah, I don't feel anything. Okay, let's go back to this one. This one, it tests negative. It tests negative as far as a reaction, and it really should have reacted to the cold test. Man, I'm not gonna lie, I was really worried about it, but you're making me feel better. Yeah. Oh, and I think what is this? Oh, it's you. Oh, you did the the subscribe thing. Awesome. No, it's not too bad. Some of the tools are gonna look really barbaric, but like I mentioned, like we kind of went over, I can kind of clear up a lot of the things that are going to happen. So 1 second, let me go grab something. And I'm back. Cool. Let's see. It's good that I can give peace of mind and everything like that when it comes to it. I've never taken antibiotics without any symptoms before, and honestly not a big fan of taking them, but I guess I have to. And it's, in certain situations, definitely it's probably good to, because there's infection there. It's probably a good sweet time to do it, but like you mentioned, during other times and everything, you probably can get around without need to take them. Just do it when you need to, so that we don't develop super bugs and everything. Like I mentioned, with the root canals and everything, they're gonna go and use these small little hand files. And these hand files, let me see, hold on. One of my students taught me how to do this. I think if I put my hand there, it can autofocus on whatever I'm trying to display to you. But we have these small little hand files, and they're all these different colors, going from white, white, yellow, red, blue, green, black. And these little hand files is what they use to go and, let me focus myself. Good. These hand files are what they use to go into the tooth and kind of pull out anything that's dead in there. It's not that bad. Because the tooth is already dead, you're really not going to feel too much pain as far as tooth-wise. It's going to be super easy to numb you. If they do put the rubber dam like we have up here in this picture, you might feel some pressure around that tooth or around the gums. I doubt they're going to use it though. Um, they may even give you what's something that's called. They may give you a shot that goes directly into the tooth, but since your tooth is already dead, you won't really feel it. But once I get it all cleaned up, it's pretty simple, pretty easy, pretty simple, pretty good at procedure. If you've never had one before, a front tooth is a wonderful one to have it on, which is cool. One thing to do. She said I have to go back to the dentist to get filled up. That's exactly what I was about to tell you. Exactly what I mentioned about that. She said she'll do temporary filling to go back to my dentist. Oh, so they're sending you out to a endodontist. They're sending you out to a root canal specialist to do it. And if they are, and that place is probably like pretty expensive. I don't know how your guys' system as far as dental care goes, but for a front tooth, for a front tooth, for an endodontist, a root canal specialist, they're supposed to be specialists. Yeah. It's not bad. You're gonna get my dentist is also quite far away. Oh, that's unfortunate. That's unfortunate. Root canals, especially in the front teeth. So you referred me to them. That's good. Root canals, especially in the front teeth, are really, really easy. Any dentist, they all learn how to do all the same procedures. The it's easy money. Why wouldn't a normal dentist do the root canal? But I've had that before. I worked for a dentist for 6 years, 6.5 years. That was not a specialist, but he liked doing root canals. So we worked on hard ones, all the way in the back, on the top, very small mouths, everything's upside down and backwards. And I've assisted for 4 hours straight working on molar teeth, in root canals and everything like that. A front tooth root canal, you can belt one of those out in like 45 minutes, and it be easy done, easy money. So sometimes when I hear normal general dentists refer out easy ones like that, it's because they just don't want to do root canals. It's not something that they fancy. You got to be a special type of person that can feel every small little minor nook and cranny with your fingers to be able to do one right. But it makes him better. He's a close family friend, and he just wanted me to do it by a specialist. That's good. It's a smart way. I mean, if you wanted to get anything done, it's nice to have the specialist do it, and they'll be even quicker. They're really good. They tend to have specialized equipment to make it even easier on themselves, which makes it easier on the patient. So that's good. One of the things, and don't freak out when it comes to knowing what it is, especially since you kind of have like new knowledge, or you have kind of all access knowledge to what can happen during it. Thank you for mentioning that. They're going to use a bunch of different things. Like one of the steps that they'll do is, actually, stick around for a second. I'm going to bring something up and you can kind of learn about the different steps. And the reason being is because I teach dental assisting. So I know from just experience how to break things down. And then just from experience knowing how to break things down for people that are going to be working with dentists. But I see someone over on the YouTube chat that mentioned something. I was diagnosed with depression years ago and didn't take care of my oral hygiene. Now most of my teeth have cavities and most of the time I get mouth ulcers. What should I do? Very unfortunate. And I'll call you Joker. We'll just go with that. Kuro Joker? Kuro? No, I was thinking Kiro, which would be yellow. But I think Kuro is black Joker in that case. I'm not sure. I'm just riffing off the top of my head. Stick around, Sydney. I'm gonna go bring like a little list up and you'll kind of see it. Joker, very common for people to go through stages in their life, whether it be depression, whether it be chemo treatment, cancer treatment, stuff that can affect your body. One of the main things that comes from it is getting dry mouth, and a lot of times it's based on medications that people would take. In certain cases like depression. Oh, they put you on depression medication, and that might not be your case, but a lot of medications come with a side effect of xerostoma, which is dry mouth. And if you have a dry mouth, your mouth naturally is its own self-working car wash, and if you can't produce the saliva to wash your teeth naturally, you get cavities pretty quick. And it's sad to see, especially after people that go through chemo treatment, that their salivary chemo treatment and radiation treatment for cancer, especially on their head, it kills their salivary glands and they can't produce saliva as easy, and all their teeth rot out. And it's a sad side effect. Sadly, it happens, but best thing to do, especially if it's a dry mouth issue, always have access to water. Rinse your mouth out, even if it's just a quick, just sip some water, swish it around, drink it. That's good to reset your mouth to a nice normalized balance. High fluoride toothpaste is also good. If you go to a dentist and you ever get work done, hopefully they're using materials, like if you end up getting crowns, there's material that's called glass ionomer or Fuji, and it releases fluoride. Fluoride in your case is going to be your best friend when it comes to anything, because that's going to fight against new cavities developing around fillings, around crowns that you have. That's what you want to you want to just kind of safeguard against a lot of those things. Another thing that to keep in mind when it comes to it is just another thing to keep in mind to it is going to be certain times when you do brushing your teeth. If you're going to brush your teeth frequently, that's awesome. Always do it after eating and such. If you only are used to brushing one time a day, do it at night before you go to bed. You don't have any calculus, or you don't have any streptococcus mutans. That's the germ that makes cavities. You don't have those on your teeth for the next 8 hours of sleep and such. So that's something that you want to kind of keep always fighting against. If you like to chew on stuff and you like to chew gum, sugar-free gum, especially anything like Trident, Orbit's gums, things that has xylitol in it. That's going to be your best friend for helping with that salivary flow, which then washes your mouth and gets that all going again. Sydney, I promised you a little, and this might not even be beneficial towards you, but let me bring up my dental specialties booklet that I made, and let's do not specialty trays. I don't need that. Yeah, I don't need to show you the instruments. I just wanted to show you the steps, which still I probably don't need to, but where is it? Dental lesson plan, specialty course. And then I think I put this in week 4 or 5. Yeah, that should work. All right, let me bring that into frame. And cool, awesome. So I got this. Please drop a lock on the. I can look at my moderator, Flu. You are awesome, and I'm seeing a weird number of people. I'm seeing a weird number on my little counter up there, going from numbers that I usually don't see. So I'm glad that it's that we're getting some traction. All right. So Sydney, so if I start my antibiotics tomorrow, should I feel anything different, or do I just feel normal? You should feel normal. You don't have pain. You don't have the infection's not causing you issues. You don't have pain, so you're more likely fine. Most of the time, if there is infection, and it's not building up into like a balloon that wants to pop, sometimes it'll show up as like a little small pimple on your gums, and that's constantly draining out the exudate, the fluid, the pus, and that will keep it so that you don't feel anything already. But if you did have a hot tooth, then you would feel something, and that's where we would find issues. Like I mentioned before, we start with anesthesia, so you get yourself numb. Yours is going to be easily. Isolation, that just means that they're going to put that little rubber dam, the coat over your tooth to keep it nice and dry and contained. They're going to drill a little hole into the tooth so that they can access the canals, and from there they're going to irrigate. I mentioned specifically the irrigation because with this irrigation that they have, this is going to be a a medical solution that's going to make sure that the inside of the tooth is clean. It's going to make sure that nothing doesn't grow there, and it's gonna super deodorize the inside of the tooth. The special thing about this irrigation, a lot of times it tends to be sodium hypochlorite mixed with water. And so if you know what sodium hypochlorite is, that's bleach. And it's just medical grade bleach. So it's usually a concoction of like anywhere from 10 to 50% bleach, and then the rest of the other half of the ratio is water. And that works really well to get everything clean, deodorized, and everything like that. If you ever taste it and you're like, oh man, it smells like bleach, totally normal. It's been used for decades to centuries to root canal teeth that way. After they go and do that, after they go and deodorize and everything, they'll establish working length. That means they're going to see how long that tooth is so that they can clean out every little nook and cranny. Back to irrigating. They're going to clean it out and everything like that. And then they're going to irrigate it with that bleach water again. They'll get to the final stages where they're going to go and put this pink stuff in there, and that's going to cork it up that's going to plug it up like a cork in a wine bottle so that nothing can go in, nothing can come out. And then they're going to close that access chamber, the hole that they did at the beginning with that temporary filling like you talked about earlier. Then they're going to take an x-ray. It all looks just like this that we have right here at the bottom as far as steps. So that's where infected tooth, opening the tooth, putting files in the tooth to see how deep it is, and cleaning it out. And then like I mentioned from before earlier, they're going to go and put some pink stuff. They call that gutta percha to seal it up. Nothing can go in, nothing comes out. They'll do the filling later on as they go and do that portion. And they'll finalize it with a crown on top of it at the end, so it's nice and protected from everything. So big thing about it, get your root canal done. Don't chew on that tooth. Even though it's right there in the front on your left side, make everything chew on the right side, or like bite an apple, bite it on the right side. Because once it's already dead. Once it's hollowed out and root canaled, it's going to be brittle. So the faster that you can get back to your usual dentist for the crown replacement, the better. Man, I talk way too much. And I don't even have any background music on. Yeah, anytime. We'll just call you Sydney at that point. I was gonna say man. But definitely, if you ever have any questions, you know where to drop by. You've already subscribed. I think I saw it in the background and everything. So you got good things to go. But yeah, I found the infection through the x-ray. Yeah, with the x-rays and everything for those, they'll show up. Yeah, dark. Yeah, I was about to bring up an x-ray. Yep, the little dark, small, circular spot over the top of the root tip. And actually going into my next term's class, I'm going to be teaching x-rays to my students. So that's always the fun ones that I like bringing up to them is like, hey, what does this look like to you guys? And they're like, oh, it's just a dark spot. But yeah, that dark spot's something super bad for the most part. So that is always a good one. But look at you, you're already ready to be so do they clean out the dark spot? That dark spot that you're mentioning here, and I know I have one here. Where is it? Landmark, bite wing errors, radiological errors, intraoral radiographs. Where is mine here? Landmark x-rays? I think this is the one that I usually do. Because I have some pictures of huge radiolucencies at that point. Alright, so let's do that. Let's do a new one. Let's do that suckerfish. Let's go and bring the chrome one down. And let's go and expand that sucker. So here is a X-ray of a front tooth and everything like that, with a big old radiolucency, or a dark spot above and everything like that. So when they do the root canal and everything, they're only going to have access to clean the inside portion, which is going to be smaller than that, which is going to be this section. And they're going to plug that all up with, like I mentioned before, pink stuff. And so now that that's all filled up with gutta percha and everything, the antibiotics is going to come in through these side areas, because there's going to be little blood vessels that are going to go into each one of these regions. And in each one of those little vessels and everything like that is going to be that nice little amoxicillin coming in, small little particles coming in and attacking all this dark spot area. So it's going to take care of the infection on its own, because all this is plugged up and the goo that was normally in the tooth can't feed and slide its way out here to feed the bacteria. It will not continue to grow, and this whole space will refill back up with bone eventually. So it'll fill up, but with the aid of the antibiotics, it will fill up faster. It will get rid of it faster and everything. So that is, it's usually how they handle it and such. So the root canal is to stop the tooth from aiding the infection. Boom. Look who's the dental assistant here. I know that you're working in the field. You're just testing me through all these different spots. Or you're just a real smart cookie, which is probably what's happening here too. You think you're able to think things all the way through. But yeah, the tooth acts as the food for the infection to keep on growing, right? So if we can stop, or if we can take away the food, infection doesn't grow. Antibiotics comes and hits it from behind. Everything is cleared to go from there. So usually that. Yeah, it's. There's controversy behind, and I really shouldn't be kind of like talking about it, but it's always nice to have all different angles of every conversation, because there are some reports out there. There are some dentists out there and medical doctors that are like, root canals are like the worst thing for you. Why would you get them? Why would you leave a dead thing still in your body? We'd never do that. If you have something that's dead on you, like a toe, you take that thing off. It's different when it comes to dental stuff in its own way, because we can kill it, deodorize, devitalized, clean it out really good, that we can leave something in you that's going to be capped and corked and all that stuff, and it be safe, and you still get to chew with it, because the only alternative to not getting a root canal is letting the tooth break off even more, or just getting it extracted or removed, and no one wants to have a missing 2-1. That's just not nice. The only alternative at that point is to do like a bridge or a partial denture or an implant. Back to the old thing, back to implants like I was talking about earlier. So it's a lot of good stuff. So my best option really, yeah, it's the best way to keep it. It's the best solution to keeping something in there and it being like training wheels. I guess it's sooner. I guess sooner better. Yeah, sooner the better, definitely. Root canals are not a last stop shop treatment. Root canals, through like dental insurances, root canals will usually be here in the States, they consider a root canal successful if it can last 5 years. You're getting it done by a specialist. More than likely, it will last longer than that, especially since you're going to be taking care of it really well. But let's say the root canal lasts you for 10 years, and then it fails. Sometimes they fail after a long period of time. You can get it potentially retreated or retreat the root canal and get another set amount of years out of it. And then if it fails again after the retreat, then the option after that would to be to extract it and do an implant or a bridge. But you can kind of look at it as you got 10 to 20 years of your natural tooth being there, and through that time maybe you're able to get a job that has better insurances, or just be in a situation where you can afford it. Now you can tackle that bigger cost of the implant or the bridge, and you were able to use that tooth for all that time. What happens when they fail? You get another dark spot at the root tip again, and if it's at the root tip, that just means it failed for some odd reason. The worst part of it failing, if it does, because it can either fail due to age, or it can fail because it got cracked, and not cracked like the top of the tooth cracked, cracked in the way where, if I expand this out, we have a jagged crack line that goes from like the outside to the end. Because now bacteria and stuff can flow into from this area, and that will be a crack that makes it non-restorable. So now we have to go over to removing it, implant or bridge, or denture if you need to. So worst case scenarios, if a root canal fails, they have to remove the tooth. Yeah, pretty much. And the longer you can keep your natural teeth there, whether they're alive or dead, the better. So there's a lot of things when it comes to it. But you're in good hands. You got a good selection of close friend dentists and close friend dentist referral people. So referring you to people. So great hands up there in Canada. I believe I'm talking to the Canada person. Yeah, 2-1. I remember. In terms of just fixing cavities, do I have to be able to? No. With cavities, because it's not dealing with the blood, because with cavities you're not dealing with the blood supply of the tooth and it being alive, just normal drill it and fill it stuff. Or I should say normal and numbing, drill it, fill it, all good and done. The only time that someone would be put on antibiotics, like for reoccurring treatment, would be because they have an artificial joint in their body. They have an artificial limb. They have an artificial hinge or heart. They have a like a pacemaker or something like that. Then they would put someone on 2 grams of amoxicillin right before they come into the dental office, so that the medicine is coursing through their veins in case something happens. But for normal everyday people, nah, just normal numb, drill and fill. Standard things like that. Yeah, definitely good questions overall. Thank you for the chat. Don't worry, I'm not going anywhere. I'm actually just gonna throw on a game, which was the whole intention. I had a front tooth replaced. It's not too bad. Yeah, there you go. Look at my boy Flu. Hold on, I was gonna say, my moderator, right? I think you have mod duties over there. Yeah, you have the sword. Yep. Oh, that's okay. I didn't get to adjust that. There we go. But man, that was a good long 2-hour sesh of things to talk about. Very, very exciting. Very impressed. Where does it have this? This is the ally. Okay, that'd probably be fine right over here. Let's do security breach. I want to try to finish this one. Faceplant on electric scooter. Oof. Trauma, yeah. Oof. Should I anticipate any pain after procedure? It can be. Hold on. Why am I starting all from the beginning? That's weird. Sore. If they use the rubber dam, they'll put a clamp around that tooth, which if it rides up on the gums, then your gums will be sore a little bit. But usually it's just gonna be sore to the touch, but you won't have pain. You won't have pain from it. Just like I mentioned before, the tooth that I had that needed a root canal, that was just a filling at the beginning. After that day, it felt weird to push on it in this direction with lateral force. But then, like my doctor tells all the patients that do that, the way to solve that is to take away that abnormal force, and then you'll be fine. There's some people that are like, yeah, if I push on it like this and twinkle my toes, if I can feel something, it's like, stop doing that. That's abnormal to do. So there's a lot of things like that. 6 a.m. Yeah, that's one I want to be on. Let's see. There's no pain, but it feels like, yeah, exactly. Yeah, that ghost feeling, that phantom feeling. The endodontist said it's 85%. Oh, 85% only? Shoot, that thing's in it. That thing, especially at in the front tooth. Oh, I'm pretty sure you have a high chance of it being successful. But they always got to put that moniker in there that there's always a 10 to 15% chance of it failing. But you should be fine. Took me 2 years ish to stop noticing. Yeah, that phantom tooth pain is a wicked weird feeling. Definitely is. So I guess if it's not successful, they'll have to remove the tooth. If it's not successful, and let's see, if it's not successful, you could get it root canaled, a root canal retreatment. But if it's not successful because it's like cracked for some reason, it's got a like a hairline crack that's on the root surface, then at that point, yeah, the tooth will need to be removed, and implant or a bridge would need to be placed. But I don't expect that to be happening, because sometimes when you do have that situation, you'll have that dark spot. Instead of it being here, it'll be like right down here along that crack region. And so if we see the radiolucency, the dark spot over here in this cracked region, that's where it's like, oh no, there's something super abnormal about this spot. So that's where their expertise and knowledge will catch those weird things. I know I'm further than that at that spot. Why does it say that I'm not there yet? February 1st at 8 p.m. at the 5-hour mark, 12:30, 12:36. Really? Did I not? I know I saved. Unless someone saved over my thing. February 1st, February 1st. February 6th. That doesn't make sense though, because that's only 32 minutes into the game. 12 hours, 36 minutes, 12 hours and 30 minutes. I guess I was at this part. That sucks. So I guess they'll have to remove the tooth. The dark spot on my x-rays is hovering over 2122. Okay, so it's between tooth number 9 and tooth number 10. More than likely, oh, baby tooth is awake. 1 second. Well, I guess it's time for me to call it a night and everything like that. Thank you guys for sticking around and keeping me busy and everything like that. Hope we can talk in the future. Flu, thanks for keeping everything uptight and everyone in ship shape, my mod. And then yeah, you guys take it easy, definitely. And let me get this going. Oh, Joker! Did I answer your question from earlier? I did, right? I hope I did. Thankfully, you stuck around for a lot of my nonsensical talking and everything like that. But yeah, you take it easy. Take it easy. Come back anytime. I'll be here regularly, randomly regular.